Introduction to sexual addiction. Sexual addiction, often referred to as compulsive sexual behavior, is a complex condition characterized by persistent and escalating sexual thoughts, urges, and behaviors that cause significant distress or impairment in one's life. It is not merely about frequent sexual activity, but rather the inability to control these behaviors despite negative consequences. Understanding this distinction is crucial for both diagnosis and effective treatment. The impact of sexual addiction can be profound, affecting relationships, finances, employment, and mental health. This course will provide a foundational framework for comprehending and addressing this challenging issue. The journey of recovery from sexual addiction requires a multifaceted approach, encompassing psychological, emotional, and often spiritual dimensions. It involves recognizing the patterns of behavior, identifying underlying triggers, and developing healthier coping mechanisms. This diploma aims to equip practitioners with the necessary tools and insights to guide individuals through this intricate process. We will explore various therapeutic modalities and support systems designed to foster lasting change and improved well-being for those affected. Defining sexual addiction. Sexual addiction is characterized by a pattern of escalating, out-of-control sexual behaviors that persist despite adverse consequences. It is not defined by the specific sexual acts themselves, but by the compulsive nature of the engagement and the individual's inability to stop. Key indicators include preoccupation with sexual thoughts, urges, or fantasies, and engaging in sexual behaviors as a primary coping mechanism for stress, anxiety, or other emotional discomfort. The behavior often becomes ritualized, involving a buildup of tension, engagement in the act, and subsequent feelings of shame or guilt. This cycle perpetuates the addiction, making it difficult to break without intervention. Distinguishing sexual addiction from high libido or healthy sexual expression is vital for accurate diagnosis. High libido involves a strong, healthy desire for sexual activity that is integrated into a balanced life and relationships, without causing distress or impairment. Sexual addiction, conversely, involves a loss of control, a sense of compulsion, and negative life impacts. The focus shifts from pleasure and connection to a desperate attempt to regulate emotions or escape reality. Understanding these nuances helps in identifying individuals who genuinely require therapeutic support. Understanding compulsive sexual behavior. Compulsive sexual behavior, CSB, is characterized by repetitive and intense sexual urges, fantasies, and behaviors that are difficult to control and cause significant distress or impairment. These behaviors often serve as a maladaptive coping mechanism, providing temporary relief from underlying emotional pain, stress, or trauma. The individual may feel driven to engage in these acts despite a desire to stop, leading to feelings of shame, guilt, and hopelessness. The compulsion often overrides rational thought and awareness of negative consequences, creating a powerful internal struggle. It is crucial to recognize that CSB is not a moral failing, but a mental health condition requiring professional intervention. The spectrum of compulsive sexual behaviors is broad, ranging from excessive masturbation and pornography use to multiple sexual partners, anonymous sex, or risky sexual activities. What unifies these diverse expressions is the underlying compulsive pattern and the individual's inability to regulate the behavior. The intensity and frequency of these behaviors typically escalate over time, requiring more extreme or frequent engagement to achieve the same emotional fix. This escalation further entrenches the addictive cycle, making it harder to break without targeted therapeutic support and a strong commitment to recovery. The cycle of addiction. The cycle of addiction, particularly in the context of sexual addiction, typically involves several distinct phases that perpetuate the behavior. It often begins with a preoccupation phase, where the individual experiences intrusive thoughts, fantasies, or urges related to sexual activity. This leads to a ritualization phase, where specific behaviors or routines are developed to prepare for the sexual act, building anticipation and tension. The third phase is the acting out phase, where the individual engages in the compulsive sexual behavior, often seeking a temporary escape or emotional release. This release is usually short-lived and followed by the fourth phase. The final phase of the addiction cycle is despair, shame, and guilt, often accompanied by promises to stop the behavior. However, these feelings are often overwhelming and lead back to the preoccupation phase, restarting the cycle. This cyclical pattern reinforces itself, making it increasingly difficult for individuals to break free without external intervention and support. Understanding this cycle is fundamental for therapists to identify intervention points and help clients develop strategies to disrupt these destructive patterns. Breaking the cycle requires conscious effort and the development of healthier coping mechanisms. Neurobiology of addiction. The neurobiology of addiction involves significant changes in the brain's reward system, particularly the dopamine pathways. When an individual engages in compulsive sexual behavior, dopamine, a neurotransmitter associated with pleasure and motivation, is released, creating a temporary feeling of euphoria or relief. Over time, the brain adapts to these surges, requiring more intense or frequent behaviors to achieve the same effect. A process known as tolerance. This adaptation leads to a desensitization of the reward system, making everyday pleasures less gratifying and reinforcing the reliance on the addictive behavior for dopamine release. The prefrontal cortex, responsible for impulse control and decision-making, also becomes impaired, further contributing to the compulsive cycle. Beyond dopamine, other neurotransmitters and brain regions play crucial roles. Serotonin, involved in mood regulation, can be dysregulated, contributing to anxiety and depression that individuals may try to self-medicate with sexual behavior. The amygdala, associated with emotional processing and fear, can also be overactive, leading to heightened stress responses. Understanding these neurobiological underpinnings helps to destigmatize addiction, framing it as a brain disease rather than a moral failing. This perspective informs pharmacological interventions and emphasizes the need for comprehensive treatment approaches that address both brain chemistry and behavioral patterns. Psychological factors. Beyond neurobiology, various psychological factors significantly contribute to the development and maintenance of sexual addiction. Low self-esteem and feelings of inadequacy are common underlying issues, where individuals may use sexual behavior to feel powerful, desirable, or validated. A history of attachment issues, such as insecure or anxious attachment styles, can lead to difficulties forming healthy relationships, driving individuals to seek intimacy or connection through compulsive sexual acts, even if those acts are ultimately isolating. The temporary high or escape provided by the behavior can mask deeper emotional wounds, creating a cycle of reliance. Coping mechanisms play a critical role. Individuals often turn to compulsive sexual behavior as a way to manage uncomfortable emotions like anxiety, depression, loneliness, or anger. It can serve as a distraction from life's stresses or as a means to avoid confronting painful realities. Perfectionism and a fear of failure can also contribute, as the pursuit of sexual experiences might offer a perceived sense of control or success when other areas of life feel overwhelming. Addressing these psychological factors through therapy is essential for long-term recovery, as it helps individuals develop healthier emotional regulation skills and self-worth. Trauma and addiction. Trauma, particularly adverse childhood experiences, ACEs, is a significant risk factor and often a root cause of sexual addiction. Experiences such as physical, emotional, or sexual abuse, neglect, or household dysfunction can profoundly impact an individual's development, leading to complex emotional wounds. These wounds can manifest as difficulties with emotional regulation, trust, intimacy, and self-worth. Compulsive sexual behaviors may then emerge as a desperate attempt to self-soothe, escape painful memories, or regain a sense of control that was lost during the traumatic experience. The behavior offers a temporary, albeit destructive, reprieve from overwhelming internal states. The link between trauma and addiction is often explained through the lens of attachment theory and neurobiological changes. Trauma can disrupt healthy attachment patterns, making it challenging for individuals to form secure bonds and leading to a search for connection or validation through sexual means. Furthermore, chronic stress from trauma can alter brain chemistry, impacting the stress response system and making individuals more susceptible to addictive behaviors. Addressing trauma effectively through trauma-informed therapy is paramount for sustainable recovery from sexual addiction, as it helps individuals process past experiences and develop healthier ways of coping and relating. Co-occurring disorders. Co-occurring disorders, also known as dual diagnoses, are highly prevalent among individuals struggling with sexual addiction. These include mental health conditions such as depression, anxiety disorders, bipolar disorder, obsessive-compulsive disorder, OCD, and personality disorders. The presence of these conditions can significantly complicate the treatment of sexual addiction, as they often interact and exacerbate each other's symptoms. For instance, an individual with anxiety might use compulsive sexual behavior to alleviate their anxious feelings, creating a self-perpetuating cycle. Effective treatment requires a holistic approach that addresses both the addiction and the co-occurring mental health issues simultaneously. Substance use disorders are also frequently co-occurring, as individuals may use drugs or alcohol to lower inhibitions, enhance sexual experiences, or numb the shame and guilt following compulsive sexual acts. The interplay between sexual addiction and substance abuse can create a particularly challenging recovery path, as both conditions reinforce addictive patterns. Screening for co-occurring disorders is a critical first step in assessment. Ensuring that all contributing factors are identified and integrated into a comprehensive treatment plan. Neglecting to address these concurrent conditions can significantly undermine recovery efforts and increase the risk of relapse. Assessment and diagnosis. Accurate assessment and diagnosis are foundational steps in managing sexual addiction. This process typically begins with a thorough clinical interview, gathering detailed information about the individual's sexual history, patterns of behavior, emotional states, and the impact of these behaviors on their life. It is crucial to establish a trusting and non-judgmental environment to encourage honest disclosure. The assessment also explores potential underlying factors such as trauma history, family dynamics, and co-occurring mental health conditions. A comprehensive understanding of the client's unique context is essential for developing an individualized treatment plan. While sexual addiction is not formally recognized as a distinct disorder in the DSM-5, clinicians often refer to compulsive sexual behavior disorder, CSBD, as described in the ICD-11. The diagnostic criteria for CSBD include a persistent pattern of failure to control intense, repetitive sexual urges or impulses, resulting in repetitive sexual behavior, causing marked distress or significant impairment in personal, family, social, educational, occupational, or other important areas of functioning. This pattern must have been evident for an extended period, e.g., 6 months or more, and not be attributable to other mental disorders or substance effects. Utilizing these criteria helps guide the diagnostic process and ensures a consistent approach to identifying the condition. Screening tools. Several screening tools can aid in the initial assessment of compulsive sexual behavior, providing a structured way to identify potential issues and guide further clinical inquiry. The Sexual Addiction Screening Test (SAST) is a widely used self-report questionnaire that helps individuals recognize patterns of compulsive sexual behavior. Another valuable tool is the CANS Sexual Addiction Screening Test (CSAST), which offers a more comprehensive assessment across various dimensions of sexual behavior. These tools are not diagnostic on their own, but serve as indicators that warrant a more in-depth clinical evaluation. Other screening instruments, such as the Compulsive Sexual Behavior Inventory, CSBI, or the Hypersexual Behavior Inventory, HBI, provide additional perspectives and can be particularly useful in research settings or for tracking progress over time. It is important to remember that these tools should always be administered and interpreted by trained professionals. They are designed to facilitate discussion and provide objective data, helping clinicians to differentiate between high sexual drive, problematic sexual behavior, and compulsive sexual behavior disorder. Proper use of screening tools enhances the accuracy and efficiency of the assessment process, leading to more targeted interventions. Differential diagnosis. Differential diagnosis is a critical step in accurately identifying compulsive sexual behavior disorder, CSBD, by ruling out other conditions that may present with similar symptoms. It involves carefully distinguishing CSBD from high libido, healthy sexual exploration, and other mental health disorders. For instance, individuals with bipolar disorder may exhibit hypersexuality during manic episodes, which is distinct from the persistent, compulsive pattern seen in CSBD. Similarly, symptoms of obsessive-compulsive disorder, OCD, can sometimes mimic CSBD, particularly if obsessions revolve around sexual themes. But the core pathology differs. Other conditions to consider include personality disorders, particularly borderline or narcissistic personality disorder, where sexual behavior might be impulsive or used for manipulation rather than compulsion. Substance use disorders can also induce hypersexual behavior, which resolves when the substance is no longer used. A thorough differential diagnosis requires a skilled clinician to meticulously evaluate the client's history, symptom presentation, and functional impairment. This careful process ensures that the individual receives the most appropriate and effective treatment, tailored to their specific underlying condition or conditions, preventing misdiagnosis and ineffective interventions. Ethical considerations in treatment. Treating sexual addiction presents unique ethical considerations that practitioners must navigate carefully. Maintaining strict confidentiality is paramount, given the sensitive nature of the disclosed behaviors. Therapists must ensure that client information is protected and only shared with explicit consent or when legally mandated. Establishing clear professional boundaries is also critical to prevent dual relationships, exploitation, or any behavior that could compromise the therapeutic relationship. This includes avoiding personal relationships, financial dealings, or any interactions outside the professional context. The power dynamic inherent in therapy necessitates a high degree of ethical vigilance to protect the client's well-being. Informed consent is another cornerstone, requiring therapists to fully explain the nature of treatment, its potential risks and benefits, alternative approaches, and the limits of confidentiality. Clients must freely agree to treatment after understanding these aspects. Furthermore, therapists must be competent in treating sexual addiction, possessing the necessary training and expertise. If a case falls outside their scope of practice, ethical guidelines mandate referral to a more qualified professional. Addressing countertransference, the therapist's emotional reactions to the client, is also vital to ensure objectivity and prevent personal biases from affecting treatment. Adhering to these ethical principles safeguards both the client and the integrity of the therapeutic process. Treatment modalities overview. Treating sexual addiction typically involves a combination of therapeutic modalities tailored to the individual's specific needs and circumstances. There is no one-size-fits-all approach, and an integrated treatment plan often yields the best outcomes. Common modalities include individual therapy, group therapy, and sometimes family or couples therapy. The primary goal across these approaches is to help individuals gain control over their compulsive behaviors, address underlying psychological issues, and develop healthier coping strategies. A comprehensive plan considers the client's history, co-occurring disorders, and support system. Cognitive behavioral therapy, CBT, and dialectical behavior therapy, DBT, are frequently utilized for their effectiveness in addressing thought patterns and emotional regulation. Psychodynamic approaches can explore deeper unconscious conflicts and past traumas. Additionally, support groups, such as Sex Addicts Anonymous, SAA, provide a crucial peer support component, fostering connection and reducing isolation. Pharmacological interventions, though not a standalone treatment, may be considered to manage co-occurring mental health conditions or reduce urges. The selection of modalities depends on a thorough assessment and ongoing collaboration between the client and therapist. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is a highly effective and widely used modality in the treatment of sexual addiction. It focuses on identifying and challenging maladaptive thought patterns and beliefs that contribute to compulsive sexual behaviors. Clients learn to recognize cognitive distortions, such as rationalization or minimization, that perpetuate the addiction cycle. By restructuring these thoughts, individuals can develop more realistic and healthy perspectives, reducing the emotional triggers that lead to acting out. CBT also emphasizes behavioral interventions, helping clients develop concrete strategies to avoid high-risk situations and replace compulsive behaviors with constructive alternatives. A key component of CBT for sexual addiction involves developing coping skills and relapse prevention strategies. This includes identifying triggers, internal and external, learning to manage urges, and practicing new, healthier responses. Techniques such as thought stopping, urge surfing, and mindfulness are often employed. Clients are encouraged to keep journals to track their thoughts, feelings, and behaviors, gaining insight into their patterns. Homework assignments, such as practicing new skills or engaging in alternative activities, are integral to applying learned concepts in real-world situations. The goal is to empower individuals to take an active role in their recovery by changing their thinking and behavior. Dialectical behavior therapy, DBT. Dialectical behavior therapy, DBT, is an adaptation of CBT that is particularly effective for individuals who experience intense emotional dysregulation, impulsivity, and interpersonal difficulties, common challenges for those with sexual addiction. DBT emphasizes a balance between acceptance and change, helping clients accept their current reality while simultaneously working towards transforming problematic behaviors. It teaches 4 core skill sets: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. These skills provide practical tools for managing overwhelming emotions and improving relationships, which are often triggers for compulsive sexual behavior. Mindfulness skills help individuals stay present and observe their urges and emotions without judgment, fostering a sense of detachment rather than immediate reaction. Distress tolerance skills equip clients to cope with intense emotional pain without resorting to destructive behaviors such as compulsive sexual acts. Emotion regulation focuses on understanding and changing emotional responses, reducing vulnerability to negative emotions. Interpersonal effectiveness skills improve communication and boundary setting, leading to healthier relationships and reducing reliance on maladaptive sexual behaviors for connection. DBT's structured approach and emphasis on skill building make it a powerful tool in recovery. Group therapy and support groups. Group therapy and support groups are invaluable components in the treatment of sexual addiction, offering a unique environment for healing and growth. In a group setting, individuals realize they are not alone in their struggles, which significantly reduces feelings of shame and isolation. The shared experience fosters a sense of community and mutual understanding, allowing members to learn from each other's experiences, challenges, and successes. Group therapy, led by a trained therapist, provides a structured space for processing emotions, practicing new skills, and receiving constructive feedback in a safe and confidential setting. It often complements individual therapy, reinforcing lessons learned. Support groups such as Sex Addicts Anonymous, SAA, or Sexaholics Anonymous, SA, operate on a 12-step model, providing peer-led support without a professional therapist. These groups emphasize spiritual principles, mutual accountability, and a structured path to recovery. While not therapy in the traditional sense, they offer a powerful framework for ongoing sobriety and personal growth. Both group therapy and support groups provide a vital network of support, helping individuals maintain motivation, navigate challenges, and build healthy relationships based on honesty and shared purpose. The sense of belonging and collective wisdom found in these groups is often a cornerstone of long-term recovery. Family systems therapy. Family systems therapy is a crucial approach when addressing sexual addiction, as it recognizes that the individual's behavior often impacts and is influenced by the broader family system. Addiction is not viewed as an isolated problem of one person, but as a symptom of dysfunction within the family unit. This therapy explores communication patterns, roles, boundaries, and emotional dynamics within the family that may contribute to or perpetuate the addictive cycle. It helps family members understand their roles, both conscious and unconscious, in the system, and how these roles might enable or hinder recovery. The goal is to identify and change unhelpful patterns. Involving family members, especially partners, in the therapeutic process can be vital for healing and establishing a supportive environment for recovery. This therapy helps family members process their own pain, anger, and betrayal, and learn healthier ways to interact with the individual in recovery. It also addresses codependency issues, where family members might inadvertently enable the addiction. By improving communication, setting clear boundaries, and fostering empathy, family systems therapy aims to create a more functional and supportive family environment. This holistic approach facilitates not only the individual's recovery, but also the healing of the entire family system, promoting long-term stability. Partner support and healing. The partners of individuals struggling with sexual addiction often experience profound emotional distress, including feelings of betrayal, anger, confusion, and deep pain. Their own healing journey is critical and requires dedicated support. It is essential for partners to have a safe space to process their emotions, understand the nature of sexual addiction, which is not about them, and learn healthy coping strategies. Support groups specifically for partners, such as S-Anon or COSA, provide invaluable peer support, helping them realize they are not alone and offering a framework for their own recovery. Individual therapy for partners is also highly recommended to address personal trauma and grief. Establishing healthy boundaries is a cornerstone of partner healing. This involves defining what is acceptable and unacceptable behavior, communicating needs clearly, and protecting one's emotional and physical well-being. Partners may also need to navigate decisions about the future of the relationship, which can be incredibly challenging. Couples therapy, when both individuals are committed to recovery and healing, can help rebuild trust, improve communication, and establish new patterns of intimacy. The healing process for partners is often long and arduous, but with appropriate support, they can reclaim their sense of self and move towards a more stable and fulfilling life, regardless of the outcome of the addict's recovery. Relapse prevention strategies. Relapse prevention is a critical component of long-term recovery from sexual addiction, focusing on equipping individuals with the skills and strategies to maintain sobriety. It involves proactively identifying potential triggers, both internal, e.g., specific emotions, thoughts, or cravings, and external, certain places, people, or situations that could lead to a return to compulsive behaviors. Developing a personalized relapse prevention plan is essential, outlining specific actions to take when faced with high-risk situations. This plan often includes a list of healthy coping mechanisms, support contacts, and emergency strategies. Key strategies include building a strong support system, which may involve regular attendance at support groups, maintaining contact with a sponsor or therapist, and fostering healthy relationships. Developing alternative healthy activities and interests helps fill the void left by the addictive behavior and provides new sources of pleasure and fulfillment. Practicing mindfulness and emotional regulation skills learned in therapy can help manage urges and prevent escalation. Regular self-care, including adequate sleep, nutrition, and exercise, also plays a vital role in maintaining overall well-being and resilience against relapse. The goal is to create a robust framework that supports sustained recovery and a fulfilling life. Identifying triggers. Identifying triggers is a foundational step in relapse prevention for sexual addiction. Triggers are specific internal or external cues that can provoke intense urges or cravings to engage in compulsive sexual behaviors. Internal triggers often include uncomfortable emotions such as stress, anxiety, loneliness, boredom, shame, or anger. These emotional states can become powerful catalysts as the individual seeks to escape or numb them through sexual activity. Recognizing these emotional patterns requires introspection and often journaling to track feelings and their correlation with urges. Understanding one's emotional landscape is crucial for proactive management. External triggers are environmental cues that can activate urges, such as specific locations, for example, a bar, a particular website, people, for example, an enabling friend, a past sexual partner, or situations, for example, being alone, certain times of day, exposure to pornography. These triggers can be subtle and insidious, often operating unconsciously until brought to awareness. A thorough assessment involves creating a detailed list of both internal and external triggers. Once identified, strategies can be developed to either avoid these triggers where possible, or, more importantly, to develop alternative, healthy responses when encountering unavoidable triggers. This proactive approach empowers individuals to regain control over their reactions. Developing coping mechanisms. Developing healthy coping mechanisms is fundamental to managing sexual addiction and preventing relapse. These are constructive strategies that individuals can employ to deal with stress, uncomfortable emotions, and urges, rather than resorting to compulsive sexual behaviors. Effective coping mechanisms are varied and highly personal, ranging from engaging in physical activity, practicing mindfulness and meditation, or pursuing creative outlets like art or music. The key is to find activities that provide genuine emotional regulation and a sense of fulfillment, rather than temporary escape. Building a repertoire of coping skills involves active practice and experimentation. This might include deep breathing exercises to manage anxiety, journaling to process emotions, connecting with supportive friends or family, or engaging in hobbies that bring joy and distraction. It is also important to have a crisis plan of immediate, accessible coping strategies for intense urges. Over time, as these new mechanisms are consistently utilized, they strengthen neural pathways associated with healthy responses, gradually replacing the ingrained addictive patterns. This process empowers individuals to navigate life's challenges with resilience and self-control, fostering long-term recovery and well-being. Building healthy relationships. Building healthy relationships is a cornerstone of recovery from sexual addiction, as isolation and dysfunctional relationship patterns often contribute to the addictive cycle. Recovery involves learning to form genuine, intimate connections based on trust, honesty, and mutual respect, rather than seeking validation or escape through sexual acts. This process often begins with repairing damaged relationships with family and partners, which requires open communication, accountability, and consistent effort. Learning to set appropriate boundaries is also crucial, protecting both the individual in recovery and their loved ones from harmful patterns. Developing new healthy friendships and support networks is equally important. This might involve connecting with individuals in recovery groups, engaging in community activities, or pursuing shared interests. These relationships provide a sense of belonging, reduce loneliness, and offer positive reinforcement for sobriety. Learning effective communication skills, including active listening and assertive expression of needs, is vital for fostering authentic connections. Ultimately, healthy relationships serve as a protective factor against relapse, providing emotional support, accountability, and a sense of purpose that reinforces a life free from compulsive sexual behavior. This journey of relational healing is transformative and essential for long-term well-being. Spirituality and recovery. For many individuals, spirituality plays a profound and transformative role in recovery from sexual addiction. Spirituality in this context does not necessarily refer to organized religion, but rather to a search for meaning, purpose, and connection to something greater than oneself. It can involve developing a personal value system, engaging in practices like meditation or prayer, or fostering a sense of interconnectedness with the world. This spiritual dimension often provides a framework for understanding one's place in the world, accepting limitations, and finding hope beyond the confines of the addiction. It can offer a sense of peace and inner strength that supports sustained sobriety. The 12-step programs, widely used in addiction recovery, explicitly incorporate spiritual principles, emphasizing the belief in a higher power, as understood by the individual, to aid in recovery. This surrender to a power greater than oneself can alleviate the burden of trying to control the addiction alone. Engaging in spiritual practices can help individuals cultivate virtues such as humility, forgiveness, compassion, and gratitude, which are essential for personal growth and healing. By fostering a spiritual connection, individuals can find renewed purpose, develop a stronger sense of self, and build resilience against the challenges of recovery, leading to a more holistic and fulfilling life beyond addiction. Long-term recovery planning. Long-term recovery planning is essential for sustaining sobriety and building a fulfilling life beyond sexual addiction. This involves creating a comprehensive, evolving plan that addresses ongoing needs and anticipates potential challenges. Key elements include maintaining a strong support network, which may involve continued engagement with support groups, regular check-ins with a therapist or sponsor, and nurturing healthy relationships. The plan should also incorporate strategies for managing stress, practicing self-care, and engaging in activities that bring joy and purpose. Recovery is not a destination, but a continuous journey, requiring vigilance and adaptation. A crucial aspect of long-term planning is developing a life balance that integrates work, relationships, hobbies, and personal growth. This helps prevent the emptiness or boredom that can sometimes trigger relapse. Regular self-assessment and reflection are vital to identify early warning signs of potential relapse and adjust the plan accordingly. This might include recognizing subtle shifts in mood, increased isolation, or a return to old thought patterns. Having a clear action plan for these moments, including contacting support and re-engaging with coping strategies, is paramount. Long-term recovery is about building a life so rich and meaningful that the allure of the addiction diminishes, replaced by genuine contentment and well-being. Professional boundaries and self-care. For professionals working in the field of sexual addiction, maintaining strict professional boundaries and prioritizing self-care are not merely ethical guidelines, but essential practices for effective and sustainable work. The intense and often emotionally charged nature of this work can lead to burnout, compassion fatigue, and vicarious trauma. Establishing clear boundaries with clients, colleagues, and supervisors helps protect the therapist's well-being and prevents ethical breaches. This includes adhering to appointment times, maintaining appropriate self-disclosure, and avoiding dual relationships. A therapist's ability to provide effective care is directly linked to their own mental and emotional health. Self-care strategies are paramount to prevent burnout and maintain professional efficacy. These can include engaging in regular supervision or consultation with experienced colleagues, participating in personal therapy, maintaining a healthy work-life balance, and pursuing hobbies and interests outside of work. Physical self-care, such as adequate sleep, nutrition, and exercise, is equally important. Recognizing one's own limitations and seeking support when needed is a sign of strength and professionalism. By prioritizing self-care, practitioners can sustain their empathy, objectivity, and effectiveness, ensuring they can continue to provide high-quality care to individuals navigating the challenging path of sexual addiction recovery. Conclusion and resources. This diploma course has provided a comprehensive overview of managing sexual addiction, from understanding its complex nature and diagnostic considerations to exploring various therapeutic modalities and essential recovery strategies. We have emphasized the importance of a holistic approach that addresses neurobiological, psychological, and relational factors. alongside the critical role of trauma-informed care and co-occurring disorder treatment. The journey of recovery is often challenging but profoundly transformative, leading individuals towards healthier relationships, greater self-awareness, and a life of purpose and fulfillment. Continued learning and professional development are vital in this evolving field. For ongoing support and further learning, numerous resources are available. These include professional organizations specializing in sexual addiction treatment, such as the Society for the Advancement of Sexual Health, SASH, or the International Institute for Trauma and Addiction Professionals, IITAP. Additionally, peer-led support groups like Sex Addicts Anonymous, SAA, and S-Anon for partners offer invaluable community and a structured path to recovery. Continued engagement with these resources, along with personal therapy and supervision, will empower practitioners to provide the highest quality of care and support individuals in their journey towards lasting healing and well-being.